This is the disease that you hear of when you hear of the catastrophic deaths of the athletes on the field collapsing and dying, or having fatal ventricular arrhythmias in the middle of soccer games. So this is that's the scary part of hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is underdiagnosed in women, I think partially because of the lack of awareness of hypertrophic cardiomyopathy in women. It really does affect 50% women and 50% men. I also think that this screening process in female athletes is probably less than what we see in male athletes in screening. Really, to diagnose this, you need both an EKG and an echocardiogram. And oftentimes in our athletic screening programs, we are not doing echoes on every athlete unless we hear a murmur or see an abnormal electrocardiogram. I think that people who have a family history obviously should be screened. I think that people who are having symptoms with exercise, such as lightheadedness, dizziness, you hear of the kids who are track athletes who pass out at the end of the race, they need to be screened for hypertrophic cardiomyopathy. I think children or adolescents with a murmur should be screened for hypertrophic cardiomyopathy. Oftentimes, hypertrophic cardiomyopathy, what we call the phenotypic expression, increases over time. So kids may not have a murmur until they're adolescents. Women oftentimes get diagnosed with hypertrophic cardiomyopathy during pregnancy too, because we tend to have a captive, a woman is seeing a physician more regularly during that time, and oftentimes they're found to have a murmur.